Andrew Yang has run as an outsider in the 2020 presidential race, and he has brought a lot of new kinds of voters into the Democratic fold by focusing on automation, job outsourcing, as well as his UBI proposal. Frankly, I do think it's a great strategy, especially in the Midwest when you're talking about job creation and job automation. What's bad strategy is what Hillary Clinton did, where she pretended to be against the TPP and trade deals that outsourced those jobs like NAFTA, which her husband was a big part of. And for Yang, it's paying dividends in polling. He just qualified for the December debate, and I do respect his outsider status and a lot of the things he brings to the table. However, I have had problems with his taxation plan for UBI. I think it's regressive, as well as his proposal to for UBI to be a replacement for government programs like disability benefits and instead of a supplement. And now I think his healthcare plan is something to add to the list of things to take issue with as a progressive, because if someone told me that this was like Mitt Romney's or some corporate Republican's healthcare plan, honestly, I would have believed it if I just looked at it. So let's break this down. This is from Yang's website as of today. We need to fix our broken healthcare system by tackling the root problems through a six-pronged approach. 1, control the cost of life-saving prescription drugs through negotiating drug prices, using international reference pricing, forced licensing, public manufacturing facilities, and importation. 2, invest in technologies to finally make health services function efficiently and reduce waste by utilizing modernized services like telehealth and assistive technology, supported by measures such as multi-state licensing laws. 3, change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practitioners. I kind of ran through that quickly because it's a lot of gobbledygook, and prescription drug cost control, importing from Canada. That's like as basic as it gets. Amy Klobuchar supports those things. Investing in technologies, changing incentive structure, that's just still maintaining, if not enhancing, a for-profit healthcare system. I'll give him his 3 additional prongs. You guys can make the decision. 4, shift our focus in educating ourselves in preventative care and end-of-life care options. 5, ensure crucial aspects of well-being, including mental health care for people with disabilities, HIV/AIDS detection and treatment, reproductive health, maternal care, dental, and vision are addressed and integrated into comprehensive care for the 21st century. 6, diminish the influence of lobbyists and special interests in the healthcare industry that makes it nearly impossible to draft and pass meaningful healthcare reform. But again, nothing specific at all. Nothing about his actual plan. Guys, this isn't even single payer, which is now the benchmark. Like, if you're not advocating for single payer, you're in the wrong party. This is to the right of what Pete and Biden are proposing. This is quite a shift from initially including Medicare for all in his ideas at the start of the campaign and saying he was kind of for it, but now he just believes in the spirit of it. I support the spirit of Medicare for all and have since the first day of this campaign. I do believe that swiftly reformatting 18% of our economy and eliminating private insurance for millions of Americans is not a realistic strategy. So we need to provide a new way forward on healthcare for all Americans, except that you didn't lay out that strategy or a way forward. Now, before I get idiots in the comment section comparing this to Warren, guys, this isn't even close. Warren's plan is 2-pronged. It's a single payer initially, and then a transition from single payer with a secondary bill around 18 months or 3 years in. It's 2 bills, right? Which I don't agree with on strategy. But again, it's a single payer to lay the institutional groundwork for Medicare for all. To the left of that is Sanders, obviously, who isn't even going to go forward with simple single payer. It's just a transition right to Medicare for all. It would just be 1 bill, which I think is the bolder and more effective approach. Then to the right of Warren, and then of course Bernie, is Buttigieg and Biden. With Medicare for all who want it, which is just single payer for Buttigieg, and then Biden, who's just advocating strength in the ACA, and then eventually single payer. Yang isn't even proposing single payer, which I think brings up an important point in evaluating these presidential candidates. Just because someone is an outsider and the establishment doesn't like them, doesn't make them a progressive on all issues. I have been screaming this from the rooftops about Tulsi Gabbard. who I've definitely been proven right there. And Yang is actually bolder and more progressive than Gabbard, I think. And his heart's really in the right place. I do think on most issues, I like that he's an outside thinker, outside the box thinker, but on healthcare, guys, this is a corporatist framework.